Okay. Hey, everybody. Welcome to the T3 Fit Scoliosis podcast. On today's episode, we have a chiropractor. His name is Dr. Jason Cooney, and he is located in Clifton, New Jersey. He has 25 years of experience, I believe. Correct me if I'm wrong on that.
23, almost.
23 years experience. He has worked with people who have scoliosis, and he's going to share with us his experience of that and with his patients and what he has learned along the way and what he has helped his patients with along the way. So Jason, I'd like to welcome you to the show.
Thank you. Thank you for having me.
Absolutely.
Nice to be here.
So please, tell us a little bit. So I know you, right? We go back a long way. But
Yes,
you got started as a chiropractor, you said, at the age of 26. What was the pivoting time in your life that you
Well, actually,
wanted to do
I grew up with chiropractic because my father was a chiropractor. So I had always been exposed to it from a young age, and I saw him help people. And I was always fascinated with it. I didn't know I wanted to do it for a profession, but I was kind of trying to figure out what I wanted to do. And he said, well, why don't you come and really spend some time with me and see what I do. So I did that. And I thought it would be something that I would really enjoy, helping people. And I was always fascinated by anatomy. And so that's kind of how I got into it initially. And in fact, when I graduated, he was still in practice, and I was able to work with him for about 8 years and learn a lot from him.
Okay.
And he was one of the early chiropractors, that started out in the 70s. So the education has actually improved a lot since then. But those old guys really started it all, and it was very interesting to learn from him. So that's initially how I got into it. Chiropractors and scoliosis is interesting because you have to, as a chiropractor is just like anything else. There's good ones and bad ones, right? So you have to be very selective and careful who you go to. I always say it's good to have a recommendation by somebody who's already going, or somebody who already has a reputation out there that's established, because there are some guys out there, unfortunately, that will say no matter what you have or what your condition is, that they're going to cure you with chiropractic, and it's just not the case. You have to know your limitations, especially with scoliosis is a good example, because there may be a chiropractor out there that's going to say, well, if you have scoliosis, come to me and we're going to fix your scoliosis. And that's just, if they say that, run for the hills, basically. Because chiropractic can be very effective in stabilizing the spine, slowing down the progression of the scoliosis, strengthening through exercises the muscles. But it's very difficult, especially with a congenital scoliosis as opposed to an acquired scoliosis. With a congenital scoliosis, it's very difficult to completely reverse the curve with chiropractic. So I always say to people, be wary of chiropractors promising too much, because, but that being said, they can help you a lot with pain, a lot with range of motion, and a lot with the stabilization of the spine through exercise, which is essentially what you're able to do with the mace, which is fantastic. And it's similar, like we would do other type of exercises, core stabilization. A great exercise that we do is just simple bridging, which you're familiar with a bridge, you lay down and you basically elevate your pelvis. Yeah, exactly. Crunches and stuff. I don't like a full sit-up, because when you do a full sit-up all the way, you're really, once you get to the very top, you're stressing the spine a lot. But a crunch or a bridge is a great way. So my experience is I've had a lot of success with active care, meaning exercise and stabilization of the spine. But it's only going to be as effective as the person is willing to do their own work basically, because you can only do so much. You
Yeah.
know, the chiropractic can help you and lead you uh, to in the right direction, but the person has to be really willing to put the work in on their own time, do the exercise, do the stretching, and work with you, and that's where you get the best results,
So, so,
basically.
so how does that work? So they come and see you and then they have exercises, or I'm going to say in air quotes, homework to do with you
Absolutely.
in between their
Right.
sessions.
Well,
And
I'll do right. Go ahead. I'm sorry.
no, no, go ahead, go ahead.
Uh, I'll teach them the exercises. I'll
Hmm.
give them they can look at videos and they'll learn the exercises. There will be some manipulation if they want it, and if it's shown to be effective with that individual. Everyone you have to I like to treat everyone individually, and see one, you have to determine, well, what's the extent of the curve. I get all sorts of people with really extreme curves, but also with very mild curves,
Okay.
that are 5 degrees, 10 degrees, 15 degrees.
Hmm.
Once I have a patient that goes beyond 30 degrees, if they don't already have one, I'm sending them right to the orthopedist
Okay.
at that point.
Okay.
Because they should at least have a consultation with them so that they can follow the track of the progression of the curve,
Hmm.
and I'll move them on. But basically, how it works is we would obtain X-rays. We would whether the radiologist or myself will do the Cobb angle. We determine the exact degrees of the curve.
Okay.
Usually, we'll see an S curve, but there are some C curves. And then we determine, we'll muscle test them. And that's really important because with scoliosis, you're going to have muscles that become weak, inhibited, inactive. And part of the treatment is to strengthen those muscles
Right.
so that they start firing again,
Hmm.
and they start supporting the spine. So we take x-rays, we'll muscle test them, we'll check their range of motion. Then we get their baseline findings, basically what we call. And then from there, we develop an exercise program and a protocol for the treatment, which usually involves a lot of stretching. I'm a firm believer that, there's two parts to this. One is strengthening, which is very important,
Hmm.
but also, as you know, flexibility is important. We want to maintain some level of flexibility.
Yeah.
And I think that's you're doing actually both with the mace,
Yeah.
which is really amazing. Like you're getting that the firing of those muscles and the strengthening of the supportive soft tissues, but you're also helping with the range of motion as well. So that's basically how we'll start out, and then we monitor the progress. And if someone's not improving with treatment, again, that's where we'll move them on to another specialty, whether it's PT, acupuncture, orthopedic care, pain management, whatever it is. You have to know if you're going in the right direction. You don't continue to treat somebody if they're not responding to the treatment.
And
So
in terms of the treatment, what are some of the well, how long does the treatment last?
well, you go you set goals, and you basically reevaluate every 4 to 6 weeks.
Okay.
So if you're going in the right direction and you're helping the person and they're reporting that they have decreased pain and increased strength and range of motion, the treatment will go on indefinitely, as long as
Okay.
they're benefiting from it.
Hmm. Okay.
But if someone's acute and they're having pain and they just want to basically get out of pain, typically you're going to have something like a 3-month treatment plan, something
Okay.
like that. And
Okay.
then after that, they'll go on some maintenance.
And what are the age ranges? Because I know with adolescents, it's very different with scoliosis as
Sure,
opposed to, people who are more mature. I'm not going to say aging, but more
absolutely,
mature. So
absolutely.
what are some of the age ranges that you have
So
personally worked with?
experience. So typically we get them when they're initially diagnosed in adolescence. So, somewhere right after puberty
Okay.
is where a lot of these, unfortunately, uh, they're not always going to be caught early on,
Hmm.
if unless the parents are have a history of knowing about it, or they see a specialist. So a lot of times it's that first that nurse, that school nurse that identifies, bend down,
Yep, to go along the
shows
spine.
your back, shows the curve. But even that, interesting enough, when you do that forward flexion test, if the curve is very mild, someone might miss it at that
Yeah.
age. But typically, if it's severe, or if the person starts to have pain, I know when you were an adolescent, you already had pain and symptoms at that
I
point,
never had
right?
pain. I never
Oh,
had
really?
pain. Yeah, I never had pain. I didn't have a noticeable rib hump. The only thing you could
All
see
right.
was one scapula protruding out. That was
So
it.
how did they find it, and then what was your progression with that with the
The
doctors?
I don't remember how they found it, but I remember at the end, I had to have the Milwaukee brace, and then in junior high school I had a brace. Uh, and I had the surgery, and my degrees were 45, 50,
Wow.
and I had the Harrington rods fused to my spine,
Yeah.
and that was
Yeah.
in 82.
Wow. Okay. Yeah.
So
So typically we'll get them in adolescence, and that's the best time to get them, because you can still help them, again, not to reverse the curve, but to
mhm,
stabilize it and
okay.
slow it down. The curve can progress 1 to 2 degrees every year, depending on treatment. So you really want to catch them early. So that's really the beginning, usually about 12 or 13. And then I'll get people who are, all the way up to their 40s and 50s, who never really had a brace, never had treatment,
Mhm.
but because they're aging, they start to get the degenerative and arthritic changes that go along with that, and they start having a lot of symptoms, basically pain at that point.
Okay.
So I'll see some people up into 30s, 40s, and 50s that it's basically the first time that they're even addressing it. So
Wow. Okay.
yeah,
A-
so
And are those people in pain when have you
yeah,
experienced that?
usually that's why that's what brought them in,
Okay.
is usually
Okay.
they start to get pain.
Okay.
And it's not unheard of. Typically, those people are not always surgical candidates, depending on how old they are. But I've
Hmm.
heard of people even getting it in their 30s and 40s. But you like to do the surgery at a young age, because it's much more effective, and I think the outcome is a lot more
Yeah.
effective,
So
when you
I
get it young.
so I have a question. I'm
Mhm.
going to throw this example out here. You have an adolescent who has a curve, let's say it's 35, and then you have somebody in their 30s who has a 35. Would you do the same techniques if those people were identical in their curvature and their skeletal structure?
You could do the same exercises, and they can still receive some manipulation, but again, you're gonna treat everybody specifically. So the younger adolescent is gonna probably be capable of withstanding a little more a little more higher level manipulation, a little
Okay.
a little more exercise. You can do a lot more without the presence of pain, because people can do more. So
Right.
the adolescent is going to be a little. I think you're going to get better results,
Okay.
because of their younger, and they don't have the degeneration and the arthritic changes in the spine yet.
Okay.
So you can be a little bit more aggressive. I'm not a super aggressive at manipulation. I think you can get the job done without um, being too rough. And that's one of the differences between kind of the old school chiropractic and the new school. Like, it's a lot of it is technique. So if
Hmm.
you have the proper technique, everyone's so scared about manipulation and getting adjusted. Not everyone, but I think a lot of that is the technique of the doctor, and his ability to do it without too much force is a lot more effective.
So how have things changed? From example, from your father who was, a chiropractor, was he more aggressive when he performed?
I think they were a little rougher. Yeah, they were very aggressive with their manipulation, and not that it wasn't effective, but I think over the years, as the profession has evolved, and certain techniques have evolved. There are other ways, to do it
Okay.
without being as aggressive, and I think you want to be as gentle as you can with still getting the job done, basically.
And
You know,
what's your thoughts on doing, performing these manipulations with somebody who has a spinal fusion?
basically, you're really not going to be manipulating the areas that are fused.
Okay.
However, you can treat the levels above and below the fusion with manipulation, but you really don't want to be manipulating into a spine that's stabilized. And there's a reason it's stabilized. You're trying to not move it
Right.
and to keep it straight. So you wouldn't manipulate that. The one thing though that tends to happen in some people is when you fuse the spine, is an aspect where the spinal levels below and above tend to have to pick up a little bit of more slack, for a better word. They have to
Okay.
work harder.
Okay.
So you can have degeneration and changes that occur on the other levels that aren't fused
Hmm.
because they're working harder and they're doing most of the work. So you can still treat them, and with people that have fused spines, you can still get them relief of their muscle pain. So we don't just do manipulation here. I do uh, the modalities. We do electric stim, we do ultrasound, we do combination ultrasound, which stimulates the muscles. There's some massage techniques, there's trigger point release, there's a technique called active release where you're stretching the muscle. Because a lot of people with scoliosis will get, even though they're not going to necessarily have nerve or spinal pain, if the surgery is successful, they will have muscle pain. So you work with the muscles as well,
Okay.
and that's something we can do with fusion. And that's great that you don't have a lot of pain though. And
Um,
I think that maybe because of your exercise, right?
yeah, so in the winters, it gets really hard for me, but I have to exercise so that I don't have.
And one of the things that's very important, and this is not just with scoliosis, we find this with degenerative conditions in the spine, is movement, motion. We say it's kind of cheesy. We say motion is lotion, basically, so
I like it that way.
uh because like the more sedentary we are, the more stiffness tends to occur.
Yeah.
So that's why the exercise and movement, even just plain old walking, people like, and it's interesting, you would think that people who have manual labor jobs, have the worst backs, and they can get hurt and they can have injuries. But what I'm seeing and a lot of the research is showing now is the people with the worst backs are the people who sit at desks all day, you know, and
What
they're
is
not
it?
moving.
Sitting is the new smoking.
Yeah. And it's because, so when you sit, basically you have just compression
Yeah.
happens, gravity and compression happens over the spine. And especially in the lumbar spine, where that's where basically all the weight of your torso is going to wind up.
Right.
So another thing I'm seeing with a lot of adolescents now, unfortunately, because of the smartphones, and just about every kid has a smartphone, is they just sit and they're looking at their phones. And my daughter does this as well, and I'm always yelling at her, and she yells back at me to shut up. But is posture. And
Yeah.
and so if anybody has a child, it's really important to impress upon them at an early age the importance of sitting up straight, because a simple thing like slouching over time, especially with a curve in your spine, could have a
Yeah.
really detrimental effect.
I want to ask one more thing about spinal fusions with
Mhm.
chiropractor. Is there anything that you would say for people like not to do? I mean, I know you talked about people doing their research and really being, being very self-involved, which is super important. But is there anything that, like, if somebody wanted to have an adjustment?
I would just say that, they ask the right questions. I would advise them not to have someone aggressively manipulate into the fused area. So, if a chiropractor would say to them, "Oh no, it's okay, don't worry about it," I would question that because, basically, you're just kind of when you adjust the spine, the goal is to have movement in the
Mhm.
joint.
Okay.
So if and although there's a tiny bit of movement in there, you don't want to adjust into the fused area. So
Okay.
that would be contraindicated. I would say but you have to be careful if someone suggests, depending on the levels, the level of fusion, traction after the fusion, because uh, you have to be careful with, someone, if you have a mechanical traction, it could be contraindicated to a fused spine as well.
Okay.
And the best way to deal with the flexibility is just stretching. And a lot of the stuff nowadays, you can, stretching your back or exercising your core. There's so many videos on YouTube too that you could find nowadays.
Which you still have to be
Just
careful with.
right. That's true. That's very true.
Um,
Um, but ask the right questions if you want to try chiropractic. Make sure that they have experience in treating it. Make sure they're not promising you the moon. Like, oh, we're gonna fix you and get rid of the curve and do
Smart.
all these things. And go slow. Make sure the person is going slow. You want to take baby steps and not be too aggressive right off the bat. And but it can be effective in reducing pain with people who have it. So
Okay.
I would suggest that is definitely a capable thing and of chiropractors to achieve.
Okay. Well,
All
I
right.
I would I Jason, I'd like to thank you for
Oh,
taking
you're
the
welcome.
time out of your
Thank you
schedule
for
to be a
having
guest.
me.
Yeah, absolutely. If anybody has any questions, please feel free to reach out to Dr. Jason Cooney at
Yes.
drjasoncooney.com.
Right.
He's happy to answer your
Absolutely.
questions along with his team. And
Yeah.
Jason, I'd like to thank you for being a guest on the T3 Fit Scoliosis
I
podcast.
really enjoyed it. Thank you, Teresa.